As many of us already know, affordable healthcare is in high demand across our nation. If you could propose a plan that could potentially begin a healthcare reform, wouldn't you share it with the world? President Barack Obama made the courageous step toward creating a healthier America. How did Obama present this step? He created the Affordable Care Act, also known as Obamacare, in March of 2010, which is a healthcare reform law. This law contains several aspects that require extensive research. As a group, we decided to take on the challenge of researching several benefits that Obamacare offers. Our goal is not to propose the Affordable Care Act as the only option toward healthcare reform, but to share the aspects we believe are beneficial to allow you to consider Obamacare as a step in the right direction towards a healthier America.
Would you be interested in staying on your parents' insurance plan until age 26? Who wouldn't? Because of the implication of Obamacare, young adults can obtain health care benefits from their parents' insurance plan until age 26. Before Obamacare, many children were no longer covered on their parents' insurance plan after age 18. Now that the Affordable Care Act has been set into motion, many young adults are obtaining health insurance, which allows them to have free or reduced doctor's appointment fees, insurance copays, and prescriptions. We believe that this aspect of the Affordable Care Act can be very beneficial to many young adults, especially college and graduate students who are paying college tuition and loans. Thanks to Obamacare, many healthcare professionals such as Dr. Robert Dunaway, DMD, of Barberville, Kentucky, are seeing positive results from the implication of the Affordable Care Act.
The impact is positive because it provides better access to preventive care, covers young adults up to age 26, provides more covered services. The Affordable Care Act has changed the way we do record keeping. We are having to transform to electronic medical records because of the influx of patients that now have coverage.
With the goal of making preventative health care more accessible and affordable for more young Americans, the Affordable Care Act ensures that no individual with pre-existing condition or chronic disease of any kind can be denied access to healthcare market. Before Obamacare, children under the age of 19 could be refused health insurance due to pre-existing conditions such as cancer, asthma, HIV, or AIDS, but no longer. Under the new law, healthcare plans that cover children cannot deny them or limit their coverage. Prior to the Affordable Care Act, insurance companies could deny coverage to children with medical conditions. Thanks to the Affordable Care Act, as many as 17 million children with pre-existing conditions can no longer be denied health insurance.
About a year ago, both my mother and my stepfather lost their jobs along with their health insurance. Because of my mom's pre-existing condition, multiple sclerosis, it was nearly impossible to find health insurance for our family. The cost was either entirely too high or we were completely denied coverage altogether. That's when my parents made the decision to sign on to Obamacare. Now my family has health coverage regardless of my mom's pre-existing condition. We also have access to preventative care such as yearly checkups. My mom also gets affordable medication for her MS, which would otherwise cost over $2,000 a month without insurance.
As you can see, the Affordable Care Act has aided many Americans in being able to obtain life-saving health care. We continue to encourage you to accept Obamacare as a temporary change until a fair health care plan can be established for all. No one can predict the future, and without health care and some form of stability, life can become a struggle. Therefore, everyone deserves a chance for hope and happiness. Obamacare, a fresh start, a new beginning, the right choice for the American people.